Hi, Jenny from Alive and Thriving. Do you remember when Dr. Milliff and I sat down and talked about OMT, Osteopathic Manipulation Therapy, and all the different benefits of it and how it can be done and what it can be done for? There was a section, if you remember, that she touched on pregnant people and how beneficial OMT is for, during pregnancy and after. And it just took on about 5 minutes of all about pregnancy and postpartum and osteopathic manipulation therapy and other things that we do at Alive and Thriving Healthcare. So this is that piece that was cut out of the original longer version. So osteopathic manipulation during pregnancy and after. I was fascinated to learn all of the things about it. Is OMT contraindicated in pregnancy?
No. Is it? No, there are some techniques specifically designed for pregnant patients.
And is that for, and this is, I really don't know this answer. So a prenatal massage, is that similar to OMT for pregnancy or no?
Not really.
Okay.
Yes, there are certain soft tissue techniques we do to kind of help. But there's also kind of more focused assessments on what we know problems are in pregnancy. And so we know like your sacrum and your hips and your pelvis all get a little like out of whack, for lack of a better term, when you're pregnant.
They're working.
Yeah. Like everything is shifting and moving. Your body is releasing hormones that are making all of your ligaments and tendons softer. And so things are kind of shifting around in a way that your body is not used to. And so you end up with a lot of hip, low back pain, booty pain, pain in your legs, swelling, all of those things. We have techniques for all of those.
So when we go back and watch this video, everyone that will see this will see the light bulb go on like in real time.
Yeah.
But I know, I mean, pregnant women get prenatal massages for like comfort and relief and relaxation. But now I'm thinking like everything that we do, if they were coming for OMT, if they were having like their hyperemesis, which, you know, vomiting a lot.
Absolutely.
They can get hydration at the same time. And we do keep things kind of mellow here. We're funny and loud sometimes, but things are pretty mellow.
In a good way. Yeah.
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 That would be an amazing gift for an expectant mother.
Absolutely.
Yeah, that would be amazing. Yeah.
To feel better, to, you know, get some hydration and nutrition, because hydration helps treat the nausea itself.
Right.
On top of like medically hydrating you, hydration helps eliminate the nausea itself.
Right. And what a lot of people don't know is that when we do, I know we're talking OMT, but when we do IV therapy, is that we do it from a scientific medical standpoint.
Exactly.
And we will take scripts from other providers.
Correct.
So if you're having a terrible time in your pregnancy with your nausea, vomiting, and your OB or midwife or whoever wants you to come and get hydration, like we will totally do that.
Absolutely.
So to be able to do that with OMT, that would be amazing.
Oh yeah.
I'm not even pregnant and I'm excited.
So many birds with one stone. Yes, yeah. All the things.
That would be amazing.
Yes.
Yeah.
Yes, absolutely. No, pregnancy is always, we see a lot of pregnant people.
Yeah. I didn't even, like, it never even occurred to me.
Pregnancy and postpartum are like some of the biggest kind of triggers for pain for women because.
Yeah, postpartum would make sense too, because everything is out here and needs to go back to where it used to be.
Well, and then you're doing activities that your body either hasn't been doing in a while or has never done before. So breastfeeding and positionally what you're doing breastfeeding.
Oh, wow. Yeah.
And then even picking up babies can trigger lots of various like tendonitis issues in your wrist, carpal tunnel, de Quervain veins, all of those things can be triggered postpartum. And so not only are you having all of that low back, SI, all of those issues, but you end up with kind of some other like newer issues a lot of the time because of just the mechanics of motherhood.
And this is, again, going off topic of OMT, but kind of not, because OMT really is a head to toe. It's all the parts and pieces.
Yes.
And a lot of times women in postpartum women,
Mm-hmm.
their needs are overlooked and not met, especially emotionally and mentally.
Mm-hmm.
So I kind of wonder if like a massage can sometimes have that emotional release,
Mm-hmm.
if that would also be triggered during an OMT session.
Oh, absolutely.
But also that is another safe space for the mom
to take care of herself.
Right.
Exactly.
And to get what she needs. Because even though we don't have, this is complete tangent, but we don't have mental health services here, but we're compiling a list of people who we trust that can help prescribe medications, do therapy, like all of the things.
Absolutely.
Yeah. And also just hanging out with us sometimes is the upper you need.
We can absolutely give you some serotonin.
Yeah. We're dripping with serotonin around here. Little dopamine hit right through the door.
Absolutely.
Yeah. But yeah.
There are lots of, like I said, we can help almost anybody with almost anything.
That's pretty cool.
Mm-hmm.
Yeah. But a lot of people don't know about it.
No, which is sad. But it's also